Hey everyone, welcome back. So let's talk about how I prepped for step two. Like I told you, I choked, I got a 250. I botched the exam day, but even then, I still got a 250. So what does that mean? I mean, I'm definitely convinced my prep was solid, even though I didn't perform on test day. The only reason I managed to get a 250 is because my prep was solid, and you're going to be a doctor. Your low performing days, you still have to be able to get by and still be able to match into residency or get that surgery done or finish your intern shift or whatever. So your lows have to still be within reason. So when do you start studying? So I took step one in I think it was like May, and then I took step two in July of the following year. I took a break after step one. The first thing I did, I told you guys, the next day I went to Alaska, camped for a week, hung out, obviously no studying. And then I came back, we had like this introduction to clerkships thing. It was online, no studying. And then I started internal medicine. Again, my rotation schedule, internal medicine, OB, primary care, surgery, psych, and then neuro. Oh, and then peds. When did I do peds? I did peds after OB. Okay. So there's people say, what should you do in terms of your clerkship order? Should you do internal medicine last because it's more relevant to step two? I think overall, I'm happier with my plan of doing internal medicine first because I want to get good at general medicine, which would help me for every shelf and would get me started earlier in terms of my step two studying and would help me in my clerkships. That's what I thought. So you have to take that break. My first like month of internal medicine, I barely studied. Maybe I read some up to date, but the first month of third year, basically zero studying. Because the best thing you can do to prepare for step two is a solid step one foundation, solid foundation your preclinical years. And again, the revered Dan the Man MD talks about this in his video. I hope you guys go watch it. But basically, the number one thing I did to prepare for step two was to push up in step one. Now, you're studying for step two, but you're managing the shelf. You're in a clerkship. You're going to get an MBME at the end of each clerkship. So you can't just study for step two. You have to also study stuff by topic for your NBMEs and your clerkship. So this is how I did it. First off, I had an Amboss subscription that I bought at the beginning of my first year of med school. It was a lifetime, basically for the 4 years. It was like $400. This was when Amboss was first starting and no one knew how amazing Amboss was going to be. Since then, it's definitely gotten more expensive. But I use Amboss throughout my step one, step two studying. Okay. So I started off Amboss, random, the one hammers. All right, so you can probably finish those. I don't know how long it'll take you, but you can do like blocks of 60, 80, 100 one hammer questions. They have like 1,000 or more one hammer questions. Those are super easy. This is just to get your feet wet. You need to have a broad scope. You need to know what's on the test, like every little thing. And then the terms I didn't know, that I didn't understand, this would help me learn the vocabulary of step two, more medicine-y stuff. You could look them up in the Amboss library, so it was ideal. And then USMLE RX by topic. Again, first I did by topic all of the easy questions on USMLE RX for internal medicine, and then all the medium ones, and then all the hard ones. USMLE RX, the hard ones, are like the three hammers of Amboss. So you should literally be able to do blocks of USMLE RX, just the hard ones, like 40 questions at a time. That's how I studied for each shelf. Did the same thing for OB for peds. USMLE by topic, Amboss random, except every now and then I do an Amboss block by topic of a mix of questions just to mimic the actual NBME, the shelf. So that would be like 120 questions of Amboss. And of course, before every shelf exam, I would take an NBME shelf-specific practice test, an internal medicine one, OB one, etc. Now, step two studying is totally different than step one. You're not free. You are shackled. You are tethered to the hospital, to your attending's whims and desires, okay? You can't pee until that surgery is done, whatever. So you're stuck. You're a med student. You're at the bottom of the totem pole, and life sucked for me as a med student in third year. But this means you can't wake up dilly-dally at 9 a.m. and study for 2 hours, 3 hours, and then go to the hospital whenever you want. No, you can't do that. So internal medicine, I had to show up at 6 a.m. at the hospital. So I beat them at their own game. I would show up at 5 a.m., do a block. Okay, go grab a computer, secret hidden computer in a secret spot. You gotta be a hospital ninja. You gotta know where to go. And then I would do a block, and that I would do a block of time, 40 minutes. I mean 60 minutes, 40 questions. No one bothering me. I'm not on call. No nothing. No pager. No nothing. Epic is off. My phone is off. No senior can text me. I finish that block. I show up to whatever 6 a.m. huddle, and then throughout the day I'm reviewing the block because you can review it untimed. Okay, you can be reading the answers to your own questions, and then someone can interrupt you, and it's not as critical. You're not sacrificing as much as if someone interrupted you during an actual time block. Okay, I wasn't always able to do 40 questions a day. Some days I got to the hospital late. I got to the hospital at 5:20. Okay, I could do 20 questions. Time, a block of 20 questions. It always had to be timed. It always had to be either random or by topic. But basically all the rules I set for studying applied, even if it was 10 minutes of study. If I only had time for 10 questions, that's 15 minutes. I did that, and I reviewed it. And then maybe I'll find another 15-minute break. Go to a call room and hide for 15 minutes. You're going to be unnoticed for 15 minutes, okay? Right away you get in, you log into UWorld, boom, you click, you do the 15 minutes. You don't look at your watch or your phone or whatever. The 15 minutes is your timer, and then you finish that block, okay? And then you go back. So you don't have the luxury of just sitting down doing 3-4 blocks a day every day, unfortunately. On weekends, though, definitely you can do 2 blocks in the morning and then enjoy your Saturday totally, or enjoy your Sunday completely. I avoided doing blocks at night. For me, that wasn't productive. I'd rather wake up. There was days if I wanted to get 2 blocks done, there were days where I woke up at 3 a.m. at home and boom, 10 minutes after I woke up, started the block. Because that's how it is. That's how step 2 is. You might show up late to test day. You might not be fresh. You might still be groggy. So you just have to learn how to do that. How to just get in the zone right away. So sometimes I wake up at 3 a.m., do 2 blocks, still get to the hospital at 6 a.m., having reviewed probably one of those blocks, and the rest of it reviewed that day. So USMLE by topic, Amboss random, using the pyramid scheme that I discussed, 1 hammers, 2 hammers, 3 hammers, etc. Now this is in the fall, obviously. Spring comes along, you're basically done with USMLE except like whatever 2 shelves you have left, okay? And you can keep doing them for the shelves. But now your focus is going to be, you should now have enough knowledge, foundational knowledge of every topic because you've been doing random. So you should know a little bit of psych, even though for me psych was at the end. I should know a little bit of neuro, even though neuro was at the end. Okay, you need to know a little bit about everything at this point, all right? And that's going to help you for all your shelves too, by topic shelves, because you know a little bit about everything. Because sometimes random stuff comes up. Like my internal medicine shelf, random things came up about psych, okay? And my psych shelf, random things came up about internal medicine because they're interrelated, the metabolic syndrome of psych drugs or whatever, okay? So now it's springtime. You should pretty much be done with the Amboss 3 hammers and most of the 4 hammers. And now you should be doing random blocks of Amboss 4 hammers only, okay? And why? Because now it's time to test your endurance and your resolve. Can you actually read a question fully, a hard question which comes up on actual steps exams? They're not like a mix of easy. Sometimes they're like 10 hard questions in a row. Are you able to read 4 hammer questions and still finish on time? I was able to do that, and you should be able to do that too, because you're going to be a doctor and you're going to take step 2. That's a 9-hour exam, okay? So Amboss, you're basically almost done with it. USMLE, you're basically almost done with it. Now, based on your pace, that's when I started UWorld. Maybe December, January, UWorld. And now, obviously, I'm well established in my clerkships. I know my routine. I know how to get away. I know how to hide. I know exactly when to show up. I know how to utilize my downtime. So now, as much as you can, a block of UWorld a day, if you can. If not, then you do half a block. And on the weekends, you do 1 or 2 blocks. And you need to build it up. You need to ramp it up. I was lucky in that my psych rotation was near the end. Of course, I was having other stuff that botched my study routine, but I was getting off at psych at like noon or 1 p.m. So I was coming home and I was spending 3, 4, 5 hours studying, even though they weren't as efficient as I'd like them to be. Definitely not as efficient as I was for step 1, but you have that time, okay? So if you were able to figure out your clerkship schedule so that you have time near the end, great. If not, then you're really going to have to use up your dedicated properly. I had about a month of dedicated for step 2. In that time, I was finishing UWorld. I was pretty much just exclusively on UWorld. I was done with AMBOSS. I was done with all of USMLE RX. I was just doing UWorld, and then I picked up TrueLearn. TrueLearn, new question bank at the time. I didn't know if it was very helpful or not. I think it helped me a little bit, but I definitely didn't finish it. I probably only bought like 30 days worth, did like 200 or 300 questions. But I wish I had done more of TrueLearn. So, anyways, now it's dedicated. You need to do your UWorld blocks, 2, 3, 4 blocks a day as much as you can while reviewing them. Again, now it's all back to all these like principles. They're all the same principles. It has to like for any standardized test. Random, not by topic, not by weaknesses, not by strengths. Can't do trying to be. You can't be trying to make yourself feel good. Has to be timed. Has to be in real world conditions. Waking up 7 a.m., doing your morning routine just like test day, meditating, whatever, and then hitting the question bank. Okay, no distractions. Phone away. Timed. No cheating. No whatever. And then what? You're reviewing the wrong answers only first, and as much as you can avoid reviewing correct answers. But if you have to, I know bad habits are hard to go away. Then skim by quickly to just identify your reasoning is correct. This was the reasoning, and this one distractor question answer that I didn't pick. Why I didn't pick it, and that's it. This whole time, though, okay, this whole time you're doing the passive learning stuff, which I spoke about before. I'm watching Dr. High Yield when I'm eating my Chipotle, or when I'm going on a walk. I'm listening to Divine Intervention, just for fun, just so I can pick up a thing or two, just so that when he talks about fluids for hypercalcemia or something, I recall, oh, I got a question about it, and I got screwed with bisphosphonate. But clearly the guy was hypovolemic at the same time, and fluids was going to be the right answer, or whatever. Keeps your mind going. Emma Holiday, also passive learning, great tool. Everyone knows this stuff, so you have to know what everyone knows, okay? And then just other random videos, and then I would also watch Santiago AQ, Dan the Man MD, anyone who's just motivating you to study. Okay, you can watch my video if you think I'm motivational, but maybe I'm not. But Santiago AQ had like these like interesting, curiosity provoking like videos about like theory of learning and stuff like that. All that stuff is great if it keeps you motivated, but it's definitely like not important. It's super supplemental. It's passive. The only thing that's worth doing is question banks and volume. Remember that, volume and question banks. New novel questions every time. No repeats. No reviewing your corrects. No wasting time. No doing stuff by the topics you know. No cheating yourself. No false sense of security. Get after it.